Good afternoon. My name is Elizabeth Santa Cruz from Kearney, New Jersey, and I'm the mother of two beautiful children. My daughter Mia is 10 years old, and she was diagnosed with lupus last year, just a few months before her birthday. It took 2 years to get her diagnosis. Since her diagnosis, Mia was prescribed Plaquenil, an anti-malarial drug that was approved in 1955 as a medication to treat lupus. 1955. Plaquenil may improve joint pain, skin rashes, but it's not sufficient treatment for other severe lupus symptoms, and it can take up to 6 months to see the full benefits. Plaquenil did help with the mouth ulcers, fingernail issues, but in her case, it doesn't help with the joint pain, fatigue, rash, protein in the urine, or lupus fog. Plaquenil is a pill. How do you explain to your child that she needs to take a pill on a daily basis when all her previous medications were liquid? Like many lupus patients, Mia needs to go for blood work every 3 months. This is important because it can help assess how the internal organs are functioning. Mia never liked going for blood work, even when it was once a year. There has been many occasions that Mia was about to faint. They had to put ice on her back to ensure that didn't happen. It is not easy seeing your daughter get nervous and start crying, especially when you know that this is such an important aspect. Within a year of diagnosis, Mia has seen a pediatric rheumatologist that oversees her care, pediatric dermatologist due to her skin rash, retina specialist because she's taking Plaquenil, and an eye exam is recommended. She has seen a pediatric hematologist due to a clotting abnormality, pediatric neurologist, pediatric nephrologist due to protein in the urine, and a physical therapist due to joint pain. In addition, a 504 plan was put in place at her school to address her new necessities. As you can see, my daughter needs a wide range of specialists to ensure that her basic care needs are met. Plaquenil doesn't help with lupus fatigue or extreme fatigue, which is a common and very debilitating symptom of lupus and for which is no good treatment. As a parent, I feel impotent when my daughter tells me that she's so tired that she can't even move. The weather plays an important role and factor with people diagnosed with lupus. The humidity makes her extremely tired to a point that she's not able to function. I'm never gonna forget the first time that I had to help my daughter change into her PJs because she didn't have the strength to do it. Many modifications were made at her school to address this symptom, including adding air conditioner to her classroom. Joint pain was a surprise to us. I never expected my daughter to have this symptom. There was a point that Mia was not able to walk more than 40 minutes due to joint pain. Literally, she was not able to walk. During one of her karate classes, her knee got locked. She was limping. We were concerned. What now? What does this mean for her? What can we do to help her? Thankfully, her new rheumatologist was very proactive. And after eliminating that the pain was not due to arthritis, she sent her to physical therapy. For many months, my husband took Mia to her physical therapy appointments in the mornings, just before school. In March this year, we were at the mall, and Mia said that she wanted to walk more. We said, okay. We looked at each other. We were nervous. We kept looking at her facial expressions for signals and clues. That day, Mia was able to walk for more than 2 hours. As a parent, that is such a milestone. It is as valuable and precious as her baby steps. At this age, Mia, like any other kid, should be independent with a basic task. But instead, because of lupus, I have helped my daughter take a shower, get dressed, because she was in so much pain that she was not able to do it on her own. Creating new treatments for this will give her back and many a sense of independence. Because Plaquenil was not created for lupus, this means that other approaches need to be added. As a mom, I want my daughter to have as much of a normal life as possible, and this will happen if new treatments address these symptoms. Mia is a very happy child. She's learning at an early age to have a voice. She always has a smile on her face. Lupus is an autoimmune illness that forces you to change your lifestyle. We need new treatments for disability symptoms for my daughter, for these children affected by this illness, for every single lupus warrior affected by this disease. Thank you.